A 24-year-old woman, G1P0, is brought to the emergency department by a friend. The friend tells the physician that the patient has had a drug abuse problem for a long time, but has been trying to give up her habit for her child, with mixed results. On examination, the patient seems anxious, and track marks are noted on her arms. Meiosis and diaphoresis are present, and the patient yawns intermittently. If this patient is unable to control her habit during her pregnancy, which of the following may be found in her child following birth? Choice A, high-pitched cries. Choice B, smooth philtrum. Choice C, duodenal atresia. Choice D, hemihypertrophy. Or choice E, ambiguous genitalia. I'll wait 5 seconds and answer the question. This patient is going through opioid withdrawal, which you can tell because she has the classic symptoms. She has anxiety, diaphoresis, which means she's sweating, meiosis and yawning, which are the most telling symptoms here. So the blown pupil and especially the yawning are pretty specific for opioid withdrawal. Some other opioid withdrawal symptoms I didn't include here are various flu-like symptoms, nausea, diarrhea, cramps. Those aren't so specific, but piloerection is a very specific symptom that might come up once in a while, or goosebumps in other words. So if this patient continues to abuse opioids, it's going to affect the child because opioids will pass via the placenta to the child, and then when the child is born, he's going to suddenly not have opioids. So basically the child will have withdrawal symptoms themselves, right? So that's neonatal abstinence syndrome, which can present with irritability, poor feeding, yawning, and USMLE really likes the buzzword high-pitched cry, so choice A is the correct answer. And of course, if you have a patient with neonatal abstinence syndrome and they need opioids, you treat it by weaning them off opioids. You give them low-dose morphine or something, which of course is a mu receptor agonist. You gotta know the mechanism for that. So not much else to say here, right? It's pretty straightforward. It's more just you being able to identify what this is. So let's look at some of the wrong answer choices here. Choice B, smooth philtrum. Smooth philtrum is mostly found in fetal alcohol syndrome for USMLE. It can also present with short palpebral fissures, thin upper lip, short nose, microcephaly. Probably don't need to tell you that this comes from alcohol abuse from the mother. Choice C, duodenal atresia. You need to know that duodenal atresia, as well as some other things like Hirschsprung's disease and lymphocytosis, are all associated with Down syndrome. Duodenal atresia in particular is a pretty high-yield GI diagnosis that you need to know. You need to know it can present with bilious vomiting and the double bubble sign on imaging. And both of these make sense, right? Because if my duodenum is cut off, then if it's going to be vomited back up, then of course you already have bile in it, so it's bilious vomiting. And you get the double bubble sign because the first part of the duodenum is dilated from not being able to pass forward, and then the stomach is also dilated, which forms the two bubbles. So moving on, choice D, hemihypertrophy. This is one of those weird symptoms that you'll see with a relatively low yield condition called Beckwith-Wiedemann syndrome. This is an overgrowth syndrome, which is caused by a mutation on chromosome 11. It can present with hemihypertrophy, so half of the body is bigger than the other. Macroglossia, so a large tongue. Abdominal wall defects. Hypoglycemia, because the pancreatic islet cells are also overgrowing, which can lead to hypoglycemia. And an increased risk of certain tumors, especially Wilms tumor. It's just one of those weird syndromes that comes up once in a while. Choice E, ambiguous genitalia. This is a pretty vague answer choice. It can be caused by a number of things, especially sex chromosome abnormalities. And you also need to know it can be caused by congenital adrenal hyperplasia, depending on the specific deficiency that the patient has and the sex chromosomes of the child. Because if you have a 21 or 11 hydroxylase deficiency, you'll have an excess of androgen production, and in XX patients, it can cause a pseudopenis to form or a clitoromegaly. But if you have a 17 hydroxylase deficiency, that means you can't form androgens very well. So in that case, it would be XY patients that would have ambiguous genitalia as a result. So bring it back. Neonatal abstinence syndrome is just one of those things that shows up once in a while, and you should be able to identify it pretty quickly because it's a child who is very irritable. And like I said, they really like the buzzword high-pitched cry sometimes. So usually they'll give you a second or third order question. So for example, they might ask you what you use to treat it, which like I said, tends to be low-dose opioids, mu receptor agonists like morphine. I hope you found this video helpful. I'll see you in the next one.